Hello, I talk a new system adopted by Tokyo to address the threat of infection disease. I'm describing the situation what happened in Japan. My name is Shin-Ichi Tanabe from the Department of Architecture, Waseda University, Tokyo, Japan. In February 26, 2020, after the Diamond Princess, we have a cluster in Japan, Professor Nishiura and Ostani of the Expert Committee on Countermeasure against COVID-19 at that time, and their team analyzed the number of secondary infections produced by a single infected person based on cases of infection spread. 11 clusters were carefully investigated. All clusters were associated with a close contact in indoor environments, including fitness gym, a restaurant boat on river, hospital, and a snow festival, where they are eating space in tents with poor ventilation rate. The experts committee identified conditions common to cases of the mass infection and pointed out factors that increase the risk of infection early on. Based on Nishiura's paper, a government caution is uh, publicized March 9, 2020, very early stage. First, enforce ventilation. In a room with windows, if possible, open the windows on opposite or different sides simultaneously to encourage ventilation. However, there is no established evidence of how much ventilation is adequate. Decrease the density of people. In case of clouds, reduce the density of people by securing the space of the venue and increasing the distance between people by 1-2 meters. Avoid short-range conversation, vocalization, and chanting. Avoid places where people are in close proximity to you. If you need to talk at a close distance, wear a mask to prevent the transmission of the droplet. Based on these analysis, factors that increase the risk of spread infection were identified as 3 Cs, and warnings were given to encourage behavioral change to avoid them. This is a very famous flyer government on March, closed in the venue with poor ventilation, crowded space where many gather, close contact conversation. When government are talking, the ventilation is important and to avoid the poor ventilation. So that was the reason Society of Heating, Air Conditioning and Sanitary Engineers, SHASE, and Architecture Institute Japan, AIJ, were pressed an emergency presidential disclosure, March 23, 2020. So how the importance of the ventilation and other things. So at that time, I was president of SHASE, later on the president of AIJ, but that one influenced for the researcher to encourage the ventilation and other things. The Ministry of Health, Labor and Welfare present its view on ventilation on March 30, 2020. First stage, they don't describe any adequate ventilation. This document is identified for managers of commercial facilities and other buildings that are subject to the Act on Environmental Health in Building. Poor ventilation to closed spaces is shown as a risk factor, and the necessity of ventilation as an infection prevention measure is clearly identified. It said if a ventilation rate of 30 cubic meter per hour per person, it's 8.3 liter per second person is ensured. It cannot be said that infection can be prevented with certainty, but it is not deemed an enclosed space with poor ventilation. Um, on this announcement by the ministry, people tried to increase the ventilation rate. The ventilation rate of 30 square meter per hour per person is based on the standard on indoor air quality. A CO2 concentration of the Act on Environmental Health in Buildings. This Japanese law as a standard for indoor air quality that is unique, so I briefly introduce it here. This Act on Environmental Health in Building was an act in 1970, more than 50 years. The target of this law the building which was greater or equal to the 3,000 square meter floor area for office, hotel, commercial facilities, school, entertainment facilities, theater, department store, and so on. This requires the necessary measures from the viewpoint of the indoor environment, moreover aim at advancing public health by keeping the good indoor environment in the building. So after the COVID-19, so we try to keep this code very strictly based on 1000 ppm CO2. So because of that reason, after government announced the minimum ventilation rate, so CO2 monitors every flare in Japan. It's a very simple one, it's very comprehensive one, but the people start to measure CO2 indoor and try to lower than 1000 ppm. For air cleaner, November 11, 2020, so the air cleaner must be a filtration type, a HEPA filter, and have an air volume of 5 cubic meter per minute or more. Install an air cleaner within the range of about 10 square meter from where the people live. To avoid air stagnation, match the direction of the air that takes in outside air with the direction of the air cleaner. So people start to use HEPA type of the air cleaner in the office and different places. This is a mode of transmission. It's a quite famous definition. It's contact transmission, droplet transmission, and airborne transmission. Airborne transmission occurs by the dissemination of either airborne droplet nuclei or small particle in the respirable size range containing infection agent or infective over the time and distance. And the famous one is the tuberculosis, measles, and chickenpox. So this is well known for airborne transmission. Here's a description of the requirements for airborne precaution. As you can see, the grade of equipment required by the airborne precaution is high, and this is not something that can be prepared immediately to meet the demand. I believe that one of the factors that make communication about the airborne transmission difficult is that the claim that the airborne transmission is possible for the SARS-CoV-2 may be perceived like measures defined as airborne precautions are necessary for all infected people immediately, or as an argument of suddenly this mandate the infection prevention system that is currently operated, which may cause backlash. In order to avoid the situation where communication became difficult, expressions such as a microdroplet may have been used in Japan, especially in the early stages. In the near future, it will be necessary to once separate mode of transmission and the transmission-based precaution backed by the clinical experience, classify them approximately according to the mechanism, organize necessary measures anew, and form a consensus among experts. During our team, also people is very anxious for the exhaust from the hotel the patient stay. Surrounding the people in the city may be afraid for the airborne infection. So direct exposure is mainly equivalent to the short-range airborne transmission, which is conventionally regarded as a droplet transmission. Indirect exposure is equivalent to the long-range airborne transmission, which is conventionally considered as airborne transmission. In the case of direct exposure, the key factor are the distance and the angle between the infection person and the suspicious person in the case of indirect exposure. The generation rate of, in the case of indirect exposure, the risk of infection is evaluated by setting the generation rate of infection, aerosol particle, penetration rate, and exposure time, assuming that the exposure is well mixed. The actual spread of the infection occurs in intermediate situation, and it would be worthwhile to model specified setting and propose solutions through the design of architecture and HVAC system. Around 100 years ago, Spanish flu in Japan. At that time, government announced 4 points: to avoid contact, cover mouth and nose, and vaccinated. Of course, at that time, it's no vaccination, and gaggle, but no description of ventilation. For COVID-19, one of the very important things is the very first stage government pronounce the poor ventilation is to avoid the poor ventilation is very important. This is a poster and flyer 100 years ago, and please prevent the droplet by mask and also other things, but no description of ventilation at time. So not only the government, but also the Tokyo governor Koike has a regular meeting. So we're helping them. So not only medical doctor, also for mechanical engineer like us. So importance of ventilation and others to the public. So thank you very much. This is something from Tokyo ICDC, the expertise that support Tokyo COVID-19 response. English version is available. The situation of COVID-19 others described in this brochure. Thank you very much.